Sue, thank you very much for that introduction. And I'm going to talk about vaccination in pregnancy, and currently there are 3 vaccines that are offered to pregnant women, which is influenza, pertussis vaccination against whooping cough, and more recently we've seen the introduction of COVID vaccination for pregnant women because of the pandemic. I just wanted to start by giving you some general resources and places to visit if you want to know a bit more about vaccination in pregnancy. And I think there are 3 key resources here. The top one is this thing that we call the Green Book. This is our sort of guidance manual, which is a national document for healthcare workers. And we've got a number of chapters in there that may be of interest to you. Chapter 6 talks about contraindications and special indications, and there's a section in there specifically on vaccination in pregnancy. And then we've got some disease-specific chapters which may be of use to you, one on COVID, one on influenza, and one on pertussis, and that's all available online. We've got a number of different training resources, including training resources on vaccination in pregnancy, on that website there, which is that UKHSA training resources website. And then finally, as Kirsten mentioned in the previous session, also the Oxford Vaccine Group, I think, is an excellent resource for all things to do with vaccination and immunisation. But they've got some really useful web pages for both health professionals and the public on vaccination in pregnancy. So those are the kind of general resources, I think, that are useful for IMS and vaccine pregnancy. There are also specific resources for each of the 3 vaccine programs that I'm going to talk about. And again, those will be listed at the end of each particular section. So in terms of influenza vaccination in pregnancy, we've been routinely offering women in this country an inactivated influenza vaccine since 2010. And the background here was that in 2009-10, we had what the press called the swine flu pandemic. You might remember the influenza H1N1. And it was recognized then that actually infection with that particular virus in pregnancy was leading to deaths and severe illnesses in some cases in pregnancy. So we know that the influenza in pregnancy increases certain risks. We've got some of them listed here. So we know it increases the risk of miscarriage during pregnancy. And in fact, as far back as the 1919 influenza pandemic, it was noted that actually the incidence of miscarriage went up during the first trimester during that pandemic. Maternal mortality and morbidity increases in late pregnancy if the woman is infected with the influenza virus, and that's thought to be because of T-cell suppression and because of increased oxygen demand, whilst at the same time some decrease in lung capacity because of the later stages of pregnancy. And we also know that there are more severe outcomes if the pregnant woman has other comorbidities such as obesity or diabetes. And children under the age of 6 months have the highest GP consultation rates for influenza and influenza-like illness. Vaccine safety, I think, is a really, really important feature of any vaccination program, and I think it's a key feature for vaccination in pregnancy. I think there are increased sensitivities around offering vaccines in pregnancy because the women and the healthcare workers offering them want to know what the evidence is for their safety and not just for their efficacy. This is a study that was actually published in the American Journal of Obstetrics and Gynecology as far back as 2009. And they looked at a number of different studies and concluded that no study to date has demonstrated any increased risk of maternal complications or untoward fetal outcomes associated with inactivated influenza vaccine. So we know that the influenza vaccines, or the inactivated ones, are safe to give at any trimester of pregnancy. There is a live influenza vaccine, which is offered to children from the age of 2 years up to 17 years. Because it's live, that would be contraindicated in pregnancy. So the vaccines that we offer in pregnancy are inactivated. Are they effective? What are the effects of giving these vaccines to pregnant women? Well, we know it reduces the risk of prematurity and low gestational weight. It provides passive immunity to the newborn child through transplacental transfer of antibodies in the first few months of life. There's a significant reduction of fever, respiratory illness from confirmed influenza in babies who are born to mums who were vaccinated against flu in pregnancy. It also reduces the risk of prematurity as well. So generally, what we know thus far about inactivated flu vaccines in pregnancy is that they have a good safety profile and they are effective at protecting the fetus, the mother, and the newborn baby. In terms of uptake, we're not doing terribly well. So we've got some data here from the seasonal flu program for the last 5 years. This year, it's about 33% at the moment. This is still provisional data compared to 2018-19, when it was as high as 45%. I think there are some difficulties in actually gathering this data because I think measuring vaccine uptake in pregnant women is difficult because the denominator is always shifting. But we've clearly got a way to go to try and improve access to the vaccine and try and improve uptake to it as well. In terms of where women can access a flu vaccine if they are pregnant, they can access it from their general practice. They might be able to access it from community pharmacy. A lot of pharmacies are offering flu vaccines to 18 plus. If they are employed as a healthcare worker, they can probably get it from their occupational health service, and they may be able to get it from people like yourselves. Some maternity service providers are commissioned to provide flu vaccines in pregnancy. And I think that's quite a key one for me because we know that midwives are the trusted voice for pregnant women. And if they're going to an antenatal clinic, then it would be good if we could tie up the vaccination program at the same clinic visit as well. Like I said earlier, they're all inactivated vaccines that we offer to pregnant women. And we have a preference for this thing called either QIVC or QIVR. This means quadrivalent inactivated flu vaccine, which is either a cell-based or a recombinant-based vaccine. And if you haven't got either of those, then you can use the older style egg-based vaccine. So there are 3 different choices of vaccine to offer pregnant women. Those are some of the resources. I'm not going to go through them all because we've got quite a lot of other slides to go through, but I think these slides are being made available to you, so you can have a look at those web links later. Whooping cough, or otherwise known as pertussis. This is an acute bacterial infection caused by the bacteria Bordetella pertussis. It's highly infectious. I think this and measles and chickenpox are some of the most infectious microorganisms